This is task number 15. This is performing a physical examination on a dog. I don't have a dog, and so I'm using one of my coworker's dog's puppies here. It's really the only thing I have available today. She was supposed to bring her other bigger dog, but she forgot, so she brought her puppy for me to use. So hopefully that's okay. But for the physical exam, when the client is bringing in a patient to the exam room, usually when they're walking to the exam room, I can kind of do a general assessment of several different things as they're walking into the exam room, or to while they're walking to the scale for me to get their weight. So as they're walking, I can look at their body condition score, if they're obese or thin, and I use a 1 to 9 scale, and so I'll look at them and kind of based on if they're obese or thin, and how much fat covering or how much their bones are showing. Based on several different factors, I can make a judgment of their body condition score. This puppy here, I would say we're a little bit on the pudgy side, but we also just ate. So I'd probably put this at about a 5 to 6 out of 9. You could easily palpate the ribs here. It doesn't have like fat hanging over its butt. The abdomen is a little bit distended, but like I said, the puppy just ate, so usually that's pretty typical of puppies. But it's a pretty average size puppy. There's an indentation here, slight indentation here. And so that would make me think that the puppy's not overweight, and it doesn't look malnourished or too thin or anything like that. The ribs aren't, the pelvis isn't sticking out, the ribs aren't sticking out, the spine isn't sticking out. There's a nice thin fat covering. So on my chart here, my pen. So on my chart, I would note a probably a 5 or 6 out of 9, 5 to 6 out of 9 of body condition score. I would also kind of note their mental status. Are they bright, alert, and responsive to you? Are they kind of quiet and not very alert of what's going on? Are they completely lethargic? Are they obtunded? Are they in lateral recumbency and being wheeled into the office? Are they playful? Do they seem aggressive? Are they giving signs of aggression? Are they look sick and distant? And there's different ways to kind of assess the mental status of a patient. So, but generally, if they're aware of their surroundings, they're in tune, or if they're bright and alert and responsive, you could note that as BAR in the chart, which this puppy, and I'll note this in the chart, is BAR. He's very engaged with his surroundings. He doesn't seem fearful. He doesn't seem like he's sickly, like, head down, not really wanting to engage, not feeling good, things like that. Oh, big yawn. So you can kind of gauge that from a distance too before you even get to the exam room, as they're walking to the exam room, kind of like their mental status as well. So you can also look at their posture and their gait. Are they limping? Are they favoring a limb? Are they hunched over? Or are they tall and erect and walking normally? So those kinds of things you can kind of make a note to as they're walking into the exam room, if they're limping or favoring something, or walking a little guarded or hunched over, kind of like guarding their abdomen a little bit. This puppy, I don't see any limping. I don't see any, it's not hunched over as if it's in pain. It's not crying out in pain or anything like that. So I could just note the posture and gait as normal. Another thing too is is if they're walking like sideways or circling or things like that. That could be a sign of some kind of neurological disorder as well. So you can also look at the coat condition. Is it dry? Is it flaky? Is it oily? Is there hair missing? Is the hair missing in a symmetrical order, or is it just random spots? Things like that. So the shininess or the dullness of a coat can indicate different disease processes, such as like parasites or endocrine disorders or cleanliness, just all kinds of different things that you might want to evaluate a little bit further if you notice any of those things. So this puppy has a little bit of a flaky coat, but it seems very shiny. There's no alopecia anywhere, and I don't see any parasites or anything like that. But we are going to flea comb later, so I would note the hair coat as normal in the puppy. So I don't have an assistant to help me to restrain. Once again today we are slammed busy, and the person that I was going to have help me restrain is not available. So hopefully with the puppy I'll be able to do what I need to do without an assistant positioning for me. So but when you're doing a physical exam on a patient, one of the first things you can start out with is indicators of perfusion, and you can tell that by evaluating the mucous membranes and the capillary refill time. So what you would do is you would lift the lip of the patient and assess their mucous membrane color. You want it to be a nice pink. You don't want any bright redness, which could indicate that the patient could be in shock. You also don't want any pale. You don't want very pale. That could indicate low blood pressure. You're so silly. Low blood pressure or anemia, or pale to white gums. You don't want cyanotic, which is blue. That could indicate that there is no oxygen or very, very low oxygen being perfused in tissues, and that's a state of emergency and needs to be seen and have medical attention very quickly. And then if you see yellow too, that could indicate jaundice, which is a condition of probably the liver or rapid red blood cell destruction, or some kind of post-hepatic obstruction or something like that. So any one of those you want to make a note of and let the doctor know. But this one has nice pink color, so I'll make a note that the mucous membranes are pink on the patient's chart. By the way, I do have my my materials all together here for what I'm going to need. I have the patient's record. I have a thermometer for taking the temperature. It's already lubricated. I have my watch for calculating the heart rate and the respiratory rate, and then I have a calculator too to times it as well. And I have our patient here, of course, and I have a scale right here. But anyways, going back to tissue perfusion, after you evaluate the color, you can also look at the capillary refill time, which you would depress the gums for a second, and then you would let go, and then however long it takes for the gums to refill with color, that would be your capillary refill time. So on this patient, it was 1 second, so I'll write CRT 1 second. Anything prolonged than that, about 2 seconds, would indicate a problem with the blood pressure and could indicate poor tissue perfusion. So you want to make a note of that if you have a slow capillary refill time. Or if you have a really fast one, the patient could be really nervous, scared, or possibly in shock. So you want to notice that too, or note that also. But for this patient, it took about 1 second, 1.5 seconds. So I just made the note of that there, which is a perfect range for it. So anything above 2 seconds, you want to make a note of course. So, I got stuff on me. So the other thing we can do is evaluate the heart rate and pulse quality. And so the normal heart rate and pulse quality, or normal heart rate in dogs, is 60 to 160 beats per minute. Sometimes you will find numbers above that, especially in smaller dogs and puppies, and when they're in the hospital, because they could be scared, so their heart could be racing a little bit faster too. So, but either way, you still want to make a note of that and let the doctor know that the heart rate was increased, because it could be something else going on also, such as pain or whatnot, causing the increase in heart rate. So for this puppy, hi, are you gonna let me do this? Puppy. While I'm doing this, I'm also going to evaluate the points of maximum intensity and the femoral pulse. We want the femoral pulse to be matching and in sync with the beats of the heart. If it's not, that could indicate some kind of arrhythmia going on and a problem with the heart conduction system. So, and then with the points of maximum intensity, we want to evaluate those, which is the aortic, the pulmonary, and mitral and tricuspid valves. Because when you evaluate those and their points of maximum intensity, you could tell if there's that's where you could tell where the location of a murmur might be. So when we listen to the heart, we're going to be listening for arrhythmias, any galloping, skipping of beats, things like that. We would make a note of that, and then also for I forgot my train of thought. Also for what's the word? I just totally lost it. Murmurs. We're going to be looking for murmurs. So arrhythmias, murmurs, and then making sure that the femoral pulse is in sync. Evaluating all of those things, including the heart rate, can tell us if there's a problem systemically that's going on or a problem with the heart's electrical conduction system. So what we would do is put on our stethoscope. And first I'll get my heart rate. So I'm going to count the beats for 10 seconds. Okay, I got 32. So if I do it for 10 seconds, I'll do 32 times 6, which is 192. Which is out of the normal range, but for a puppy that is normal because they have higher, like I said, they have higher heart rates. So I'm going to say 192, but we'll still make the doctor aware of that. And now I'm going to listen to the points of maximum intensity. So the aortic, on the right side you have the aortic, the pulmonary, aortic, mitral, and on this side you have the tricuspid. So I could start down here and listen, and then move up a little bit, and then move to the mitral valve, and then go over here to that tricuspid. And then everything sounds good. I don't hear any murmurs or anything with any of the points of maximum intensity. So now I'm going to check the femoral pulse and make sure it's in sync with the heartbeat. So you could palpate the femoral pulse and feel the quality as well. So I'll listen to the heart, feel the pulse. And the femoral pulse, the femoral vein or artery is back here that you're going to be feeling. So it's all in sync with each other. For every heartbeat, I feel a pulse back here. And then at that point, you can also evaluate the pulse quality as well. So you want to make sure that it's easy to find, but not like totally bounding up against your fingers, because that could mean that the blood pressure is very high. If it's bounding up against your fingers, and if it's very weak and hard to find, that could mean that you have low blood pressure. So you just want to be able to feel it easily. That's going to come with time as for gaining experience of palpating the pulse quality after probably many patients are felt, because every technician is going to have a different assessment of pulse quality. But usually you can gauge whether it's weak, normal, or bounding after you've had some experience with that. But this puppy's pulse rate is normal, so I'll make a note of that. And I didn't hear any murmurs or anything, so I'll write the no murmurs, osculated. And then so now that we've obtained our heart rate and calculated it and checked our pulse rate and quality, we can go ahead and move to the lung fields and oscillating the lungs, and then getting a respiratory rate as well. So there's several lung fields. There's 9. So there's the, I'll there's the ones on this side and then the ones on this side, and we want to feel for all of those and listen for all those, because we want to make sure that we don't hear any crackles or wheezes, and then we want to make sure that we can hear air running through every lung field, because any crackles or wheezes, those can indicate asthma or some other kind of like fluid buildup or whatnot within the lungs. And then and we want to make sure that there's no obstructions and there's complete airflow through every lung field. And then so while we're doing that, we'll also get our breathing rate as well, which the normal breathing rate. Do you see somebody out there? The normal breathing rate for dogs is about 16 to 20 or 32 breaths per minute. But a lot of times when they come into the hospital, they are panting. Sorry, there's a window behind me, so there's dogs fighting out there. I'm looking out the window. But anyways, there's dogs are panting usually when they come into the hospital because they're nervous or things like that. So you would make a note of that, because panting could also indicate other things such as pain and whatnot. So I always make a note of it if they're panting. And then we also want to make sure that they're not below about 16 or so, because you want to make sure that they're breathing appropriately, and anything lower than that could indicate a problem. We also want to make sure that they're not having problems breathing, as far as like abdominal breathing or agonal breathing, or just having any kind of respiratory distress. A lot of times the brachycephalic dogs, you kind of see that they'll have trouble breathing or whatnot, but and then we also want to make sure that they're not having very loud breathing noises, because it could indicate a problem with the trachea and whatnot. So but anyway, so we'll go ahead, and I want to make sure this is recording. Okay, good. So we'll go ahead and get our respiratory rate and listen to all the lung fields. You stay here. Did you see those doggies fighting out there? Okay, so I'll start with my rate. I'll do it for 10 seconds. And I'll just watch for the rate, but I can hear the air moving through the lungs. But so I can watch the thorax go up and down. 2, 3, 4, 5. Okay, so I'll do 5 times 6, which is 30. So I'll write my respiratory rate for 30. And now we'll go ahead and listen to the lung fields. Make sure we don't hear any crackles or wheezes, or and that we hear airflow throughout every lung field. Okay, so now that I've osculated all my lung fields, I don't hear any crackles or wheezes or like fluid in the lungs or anything like that, and I could hear air moving freely through each lung field. Another thing that I was going to mention, that if your patient is panting, you might want to gently hold their mouth closed also while you're doing this, so that you could hear a little bit better too. And then also when you're listening to the heart, you might want to hold the mouth closed too, so because the breathing can kind of disrupt the sounds of the heart. And also if the cat is purring, if you have a cat, you can you need to stop them from purring, just as a little side note there or whatnot. So so you also want to make sure well, I think, yeah, that's pretty much it for the respiratory. rate and character. And then so the other thing that we could do is take our patient's temperature. The normal temperature is about 100 through 102.5. Anything below that could indicate poor tissue or poor disease, like some kind of disease process, such as hypothyroid or anemia, and then other things. And then stuff higher than that could indicate infection or pain, inflammation, things like that. So we want to make sure that our temperature is within normal range. So we'll go ahead. This has already been lubricated. We'll see how this goes. You be good, puppy. Yeah, good puppy. Okay, so my camera totally shut off while I was filming my whole exam and didn't record any of it. So I'm gonna redo it here again. I was in the middle of the temperature when it shut off, and but I got my recorded value of 1011, and I already documented it on the chart here. And then this is the rest of my physical exam that's all been documented, but I'm going to go through everything again. So now that our temperature is in normal range, and that it's been recorded, we can move on to the physical examination. And I'm going to go through this quickly because I'm doing it on my lunch break now, so I don't have tons of time. But oh, big yawn puppy. So on the physical exam, let me make sure it's recording. Okay. On the physical exam, you could start with the head, with the eyes. You want to make sure that there's no redness, no swelling, no discharge. You want to make sure that the pupil sizes are the same, and that they don't look like they're too constricted or too dilated. You also want to look at the conjunctiva, make sure it doesn't look like it's yellow or red. All of those things which can show that there's like a sign of an infection. Allergies, and other disease processes going on in the body. So we also want to make sure that the patient isn't doing any kind of squinting in one eye or pawing at the eye, which could be a sign of irritation and whatnot. So with this patient here, he does have an issue with this eye right here. He's being treated for it. So this is just the way it's going to be. It's some kind of genetic defect or whatnot. But so I will make a note of that he does have the the defect in his right eye. But from it, there's no redness. It's not swollen. There's no discharge from it. It appears, besides the defect portion of it, the defect portion of it doesn't seem to be irritating him at all. It's not painful. He's not pawing at it. It's not swollen or anything like that. This eye looks great. There's no redness. There's no swelling. There's no discharge coming from the eye, so that one's normal. So we could put that the left eye is looks and appears normal. The other thing that we can examine on the head is the ears. We want to make sure that there's no, same thing, redness or swelling or excessive discharge, brown, green, pus, discharge, or there's no bleeding or anything like that. And then we would also ask them if they've been shaking their head or scratching at their ears, which could indicate signs of infection. This patient's ears are clear and doesn't have any discharge, no swelling, nothing looks irritated or anything. So the ears look good. The other thing that you can do is kind of smell them too. Sometimes the infection smells really bad, so you can kind of get an idea of what type of infection it is just based on the smell. So, but the ears are normal. Also, another thing is when there's and there's no growths in them either. You could also look for like growths in the ears, polyps, things like that. You could also look at the nose. You want to make sure that the nares are wide enough and able to pass air through freely and without obstruction. And then you would also look for discharge, excessive discharge, green, yellow, discharging, and make a note of that. His nose seems normal, so I'll put that the nose is normal. There's no discharge. His nares are wide enough for him to be able to breathe and whatnot. So then we can move on down to the mouth. In the patients, we've already examined our CRT and gum color, which is all great. It's pink color, and the CRT was within normal range. So this puppy has puppy teeth here, And so we want to make sure that they're all growing in well. None of them are cracked. None of them are discolored. There's not excessive wear or damage. There's no gingivitis, which is redness of the gums. And there's no excessive tartar on the teeth too, or calculus. You want to make a note of that if you see excessive calculus or gingivitis, any cracked teeth, worn teeth, any missing teeth, any extra teeth, any broken teeth, things like that. You want to make a note of. This puppy's teeth are all normal, so we'll just put that they're all normal. You also want to note any kind of malocclusions or whatnot too. You could also check their tongue, make sure it's not excessively swollen or red or has any lumps on it or growths. And then you could look at the hard and soft palate and make sure that there's not any growths, redness, signs of inflammation, things like that, all of which I do not see in this puppy. So the mouth examination, the oral examination would be normal. You can also feel their mandibular lymph nodes and salivary lymph nodes, which is in this area here. You want to make sure that they don't seem swollen or anything. And I cannot palpate them as enlarged, so I would write that as normal. Submandibular. Are you getting tired of this? Okay. And then, so then when we're done with our head exam, there's no excessive growths, everything's symmetric, there's no discharge, there's no redness, no signs of inflammation. We can move on to the neck, kind of move down. So with the neck, you can kind of move the neck in the natural directions of which way they're supposed to go. And there shouldn't be any, it shouldn't be hard to move, and there should be no pain associated with moving the neck. You could also feel the structures, the trachea, the patient. If it has an irritated trachea, sometimes when you palpate it, they'll start to cough or whatnot. So you can feel the trachea. You could also feel if there's any growths or anything, and you can kind of palpate along the cervical area and see if there's any signs of pain, which they're not in this patient. But if there was, you would definitely make a note of that and let the doctor know. So we could say that the cervical region is normal. Then we can move on down the spine. I want to make sure this is recording because last time it shut off. Okay, which it is. We're good. Then we can start to move on to the back area here. We can feel the prescapular lymph nodes too. They're right here. You want to make sure that they're not enlarged or anything like that, which could indicate some kind of problem. So, but as far as the back, you can palpate along the spine and feel each vertebrae. And if there are any pain associated with you palpating the spine, there could be, some kind of problem with the spine region. So the other thing is you can also check the patient for parasites with a flea comb. And I like to flea comb everybody because it not only kind of calms them down when they're in the exam room, but it's just a quick way of catching something, catching something underneath that could be missed. So usually when the owners are talking to me, I'll go ahead and start flea combing their pet because, like I said, it kind of calms them down and they usually like it too. So the thorax, chest area, we've already kind of osculated for that. All the lung fields were all within normal range. There wasn't any crackles or wheezes within the lung fields or anything, so that was good. As far as the abdomen, after you're done with the spine, you can move to the abdomen. To do an abdominal exam, you can put your hands along both sides of the abdomen, and you have to have a really good understanding of the anatomy of the abdomen when you're palpating for the different organs. So you could start at the most cranial aspect, which would be the stomach and the liver area up here, and you want to make sure there's no enlargement and that there's no masses, and then you can move up here to the kidney area and make sure that they're symmetrical and not enlarged or anything like that. And then you can also feel the bladder too to make sure that it's not completely distended, and which could be a sign of a obstruction or something like that. So the abdomen should also be very soft and easy to palpate. It shouldn't be rock hard, which could indicate a sign of pain and something else going on, some kind of pain associated with one of the organs in the abdomen. So it should be nice and soft. It should not be distended. my camera shut off yet again while I was in the middle of recording. So here we go again through this physical exam. So I think we were on the abdomen and I was palpating the different structures of the abdomen. I'm not quite sure exactly where it left off, but basically you want to make sure that there's no type of distension. There's no kind of enlargement with any of the organs. So you, like I think I said earlier, but you have to have a good knowledge of the anatomy of the organs within the abdomen, so that the way you know what you're feeling for. So you would start cranially and move caudally. You want to make sure that there's no pain, no tension, no tightness, tightening up or crying out in pain or whining or crying when you're palpating the abdomen too. It should be nice and soft. So you can feel like the liver and the spleen up here. Make sure there's no enlargement or masses. You can feel for the kidneys in this area here. You can feel the bladder area. Make sure it's not completely distended, which could be a sign of an obstruction. If it's really tight and hard, that could be a sign of a problem too. So that's basically palpating the abdomen. And then also when you're in that area, which this one is normal, so I will mark normal abdomen. And then everything's soft. I don't feel any enlargement. I don't feel any masses. There's no pain associated with me palpating or anything like that. So stretch. But also in females, you can look at the nipples for any signs of mastitis. You want to make sure that they're not swollen huge, that there's no discolored discharge, pain or heat associated with the nipples. And then on the males, you can check their prepuce, make sure that the penis isn't stuck out of the prepuce, that there's no excessive discharge or redness, or that they're licking at it or anything like that. All of which is normal on this patient, so I can mark normal. You can also check their testicles too on males, intact males, and make sure that they're both distended out of the inguinal area. So, and which his haven't dropped yet, so they're not there yet. So hopefully they both come down though. But after the abdomen, after palpating the abdomen, you can also check the rectum and anus area. Back here, you want to make sure that there's no redness or swelling where the anal glands are. The anal sacs are back here in this area, so you want to make sure that they're not protruding and look swollen or abscessed or anything like that. Also with diarrhea, you'll see pain, redness, and irritation associated with the anus as well too, which I don't know in this patient, but there also could be redness of the anus, and in certain kind of breeds like bulldogs, they can get irritation in that little tight space. Bulldogs, Boston Terriers, underneath the tail there. So you want to check that too, because sometimes feces and bacteria can get trapped in that tight little space there. So you want to always check that and make sure that the owners are cleaning it out appropriately and everything. So on females, you could check their vulva, make sure it doesn't look red or swollen. There's no, or that there's bleeding. Or discharge. The bleeding discharge could be normal, just depending on if they're intact and if whatever kind of estrous cycle, what part of their estrous cycle that they're in, that could be normal. But if they're not intact and you notice any kind of bleeding or swelling or discharge, but either way, if you notice any of those things, you want to make a note of it. So, but his are all normal. His anus is normal. There's no redness. There's no masses. There's no swelling or anything like that. Let me just check my camera because it keeps shutting off. Okay, looks like it's going to keep shutting off every 3 minutes. So we're back again. So the limbs, you can check the nails. Check all the nails, make sure there's no crack, that they're not cracked, that they're not bleeding, that there's no signs of infection in the paw pads. Sometimes foreign objects can get stuck in the paw pads, or you could tell because there'd be like redness or swelling or irritation that they might be licking and chewing at, or sometimes their allergies, they get allergic reactions in their paws and their paw pads. But with the nails, you want to make sure that they're not cracked, there's no splitting, and then they're not growing weird directions, which all could, be signs of like a fungal infection that could be in the nails. And then also the paw pads, if there's any redness or swelling, or anything in between the toes too, because like I said, there could be foreign objects stuck in between the toes too. So you want to make sure you check that. But you can also look at the joints of the limbs too, make sure that they're symmetrical and there's no swelling or pain associated with the joints, which there is none in this puppy. His nails, his paw pads, and his joints. I don't see any swelling or heat associated with his joints or his paw pads. And so that all looks good. You could also check their popliteal lymph nodes, which is in this back area right here behind the knee, and they're not swollen. If you do feel these back there, that could indicate a disease process, but they're not enlarged or anything like that. So I can make a note that all those things are normal within this patient. And then you can also check their range of motion within their limbs and make sure that there's no pain associated with you moving their limbs around. Pain or tension or any kind of noises, like cracking noises, things like that, which could be an indication of arthritis. Also, the swelling of the joints could indicate a problem like a tick-borne disease or something like that. So you want to make sure there's no swelling. Okay, just making sure I'm still recording. So basically the assessment of this patient here, this little puppy, everything's normal at this point except for his little genetic little defect of his eye. I don't see any swelling, I don't see any discharge. All his vitals are within normal limits. He doesn't seem to be in any kind of pain. He doesn't have any parasites or anything like that. So everything seems to be good. His coat condition is in good condition. His body condition score is normal. His oral exam, his ear, eye, nose, everything is all, except, like I said, except for that genetic defect of his eye, is all normal. So that's what I would make a note of here in his chart. Any abnormalities I would make a note of and let the doctor know right away.